Good morning, students. Today we will try to understand what is a neurodevelopmental disorder and one of the neurodevelopmental disorder, intellectual disability. So there are many disorders which are labeled under neurodevelopmental disorder such as intellectual disability, learning disability, ADHD, autism spectrum disorder. All of these are covered under neurodevelopmental disorder. So before we understand any of it, we need to know what is a neurodevelopmental disorder. See, these neurodevelopmental disorders are the group of conditions in which growth and development of the brain is affected. Yeah, here because the child is having intellectual disability, the child's brain will not have the age appropriate growth and development. Because the child is having autism spectrum disorder, the growth and development of the child's brain is affected. Yeah, here what we need to understand here is it is because of this condition the brain development is affected. It is not the other way around. It is not because the development of brain is damaged the child is having this condition. Yeah, it is to be clearly understood. It is the condition which will hamper the growth and development of the brain. So these are the conditions in which the growth and development of the brain is affected. So because it is affected, it can have its impact on several areas of child's functioning. It can be language, it can be emotions, behavior, self-control, learning, memory. It can have an impact on multiple areas of an individual's functioning. So now we know what is a neurodevelopmental disorder. It is a condition which will affect the growth and development of brain. Now we'll try to know one such neurodevelopmental disorder, which is intellectual disability, which was formerly known as mental retardation, is now called as intellectual disability. What is intellectual disability? It is a disability which is characterized by significant limitation in two areas. One is intellectual functioning, the other is adaptive behavior. By intellectual functioning, we mean several cognitive functioning such as reasoning, learning, problem solving, decision making. Yeah, when it comes to adaptive behavior, it could be conceptual, social adaptive behavior, or practical skills. So these limitations should be seen before the age of 18 years. The onset of these symptoms or the onset of these limitations noticed should be before the age of 18 years. If any of these impairments are seen after the age of 18 years, several other conditions such as early onset dementia or things like that should be evaluated. It cannot be diagnosed as intellectual disability. So the definition is clear now. It is the significant limitation in intellectual functioning which involves several cognitive functions and limitation in adaptive behavior, and the onset of these symptoms should be present before the age of 18 years. Only then it can be diagnosed as intellectual disability. So how do we assess intellectual disability? One is to assess the limitation in intellectual functioning. We need to assess how good the individual is when it comes to several cognitive abilities. For this, there are several standardized intellectual intelligence tests which gives us the IQ score. Second, how do we assess the adaptive functioning? Again, for this, we need to check how competent the individual is in social functioning. Are they able to understand the societal norms and rules? Are they able to perform everyday tasks? Even to get an objective understanding of social adaptive ability of an individual, there are standardized tests that are available. So, the severity of intellectual disability we need to know here is it is not on the basis of the IQ score that we get, but more so with the how adaptive the individual is. So this has been changed especially in DSM-5. Earlier, the severity of intellectual disability used to be primarily be based on the IQ scores that we used to get. But now in DSM-5, severity will be dependent on the adaptive capability of an individual, because the reason is the more adaptive the individual is, the less support that the individual would require. So the entire treatment approach should change. So the adaptive functioning determines the level of support that is required, and hence the severity of intellectual disability is given based on the adaptive behavior and not on the IQ scores alone. So, DSM-5 criteria for intellectual disability include significantly sub-average general intellectual functioning along with the concurrent impairment in adaptive behavior that is manifested before the age of 18 years. So, the diagnosis is made independent of coexisting physical or mental disorders. So, if the clinician chooses to use a standardized test of intelligence, which is still a common practice, what is sub-average level of intellectual functioning? It is approximately, the IQ score should be around 70. If it is less than 70, then different levels of severity of intellectual disability is made. So for adaptive functioning, it is usually the Vineland Adaptive Behavior Scale is used to assess or used to get the score of their adaptive functioning. To know more about the DSM criteria for intellectual disability, as we discussed before, the limitation should be seen in the intellectual functioning and adaptive functioning before the age of 18 years. So what are the intellectual functions? It can be reasoning, problem solving, planning, abstract thinking, judgment, academic learning, or learning from experience. There should be limitation in all of these. And one important thing is limitation in intellectual functioning should be confirmed by both clinical assessment and also by standardized intelligence testing. The clinical judgment that we make should match with the IQ score that we get with the standardized intelligence test. Another criteria is deficit in adaptive functioning that result in failure to meet developmental and socio-cultural standards for personal and social responsibility. And this deficit in adaptive functioning should be seen in multiple environments. It should be seen at home, it should be seen in school, work, or any other community. As we discussed, onset should be present in the developmental period before the age of 18 years. So this diagnostic term that we use as intellectual disability is the equivalent term for when we are using ICD-11. The diagnosis will be made intellectual developmental disorder, but it is a different names given to the same condition. But intellectual disability, according to DSM-5, is most commonly used in several other medical setups, education, or other professional setups. So, how do we evaluate the severity? We understood it is based on the adaptive functioning and not on the IQ score alone. The most commonly used one is support intensity scale that we use. Based on its score, we can assess their adaptive functioning, thereby know their severity level. So what are the degrees of severity of intellectual disability? It is mild, moderate, severe, and profound. Earlier there was a thing called as borderline intellectual functioning, which was used to describe individuals whose IQ was ranging from 70 to 80. But note that this is no longer used when we are making a diagnosis based on DSM-5. So, when we are classifying the severity as a mild intellectual disability, usually in the standardized intelligence test, the IQ score ranges from 50 to 70. So, the prevalence is around among all the people who are diagnosed with intellectual disability, 85% of them, like majority of them, will have the severity level of mild form of intellectual disability. Yeah, so they learn about the world by using the senses. They shake or throw things like any other normal child. They conform to societal rules and norms. They can take care of themselves. They can carry out their daily task as appropriately as anybody else. No usually unusual physical signs are seen. Yeah, they can acquire practical skills, even reading and mathematical skills up to 3 to 6th grade they are able to acquire. Yeah, but after that, the more important thing that differentiates them to have intellectual disability is they'll be having poor ability to abstract thinking and they'll have egocentric thinking. So next severity level is moderate intellectual disability, where the IQ score ranges between 35 to 50. And when it comes to prevalence, 10% of people diagnosed with intellectual disability fall under this severity level, that is moderate ID. These people who are diagnosed with moderate ID, they can talk or learn to communicate, yeah, but they may have a fair motor development. They benefit a lot from the training that is given to them, but they need supervision and guidance when they are encountered with any stressful situation. Participate in simple activities, self-care. They can perform supervised tasks. They can travel alone to familiar places. They can learn simple communication. They can also learn elementary health and safety skills. Most children with moderate ID, they can acquire language and they can communicate adequately, but they are not able to achieve beyond the second or third grade level of academic skills. They will also have socialization difficulties, and a great deal of social and vocational support will be highly beneficial for these moderate level of severity. Next is severe intellectual disability. The IQ score ranges between 20 to 35. Comes to prevalence, 4% of those who are diagnosed with ID fall under this severity level. These can be trained to have their own self-care, but they need a lot of direction and supervision constantly. They may have little or no communication skills, but they can be taught daily routines and repetitive activities. So next severity level is profound intellectual disability, where the IQ score will be less than 20. Only 1 to 2% who are diagnosed with ID will have this severity level. They are almost dependent even for their self-care. Their speech and motor development will be poor. They will need constant nursing care. Yeah, even they will have show gross disability, the minimal capacity for functioning in sensory motor areas. Most of those who are diagnosed with profound intellectual disability, they will have some identifiable cause for their condition, like Fragile X syndrome, Down syndrome. There will be some identifiable cause for their profound level of severity of intellectual disability. So, based on the different levels of severity, such as mild, moderate, severe, and profound, we need to understand which are the areas of impairment that each of these levels of severity shows. Like what is their motor development, what is the language development, self-care and safety, what are the physical signs that are shown based on different levels of severity, how can the vocational training help them, what is the extent of support that is required for them. All these areas of impairment should be checked for each level of severity. Thank you.